my name is Natalie,
And I'm Scott.
and we're going to teach you how to measure blood pressure today.
And before we get started, I want to give you a little bit of information about what blood pressure is. A normal blood pressure reading could be 110 over 70. The higher number here, which is 110, is the systolic blood pressure, and that is when the left ventricle is in contraction. The lower number, which was 70, is the diastolic blood pressure, which is when the heart is at rest. Now, this is important for a physical therapist to know what their patient's blood pressure is because we want to be able to coin our plan of care around that. For instance, if we have a patient who has hypertension, we want to be conscious of that and not get their heart rate up to a level too high of what they should be working out at.
Right. Our patient's blood pressure can really reveal what their exercise tolerance could be, so it definitely is important to know. So let's get started. Hi, my name is Natalie. I'll be your physical therapist today. What's your name?
My name is Scott.
Scott. Nice to meet you. So where are you from, Scott?
I'm from Cincinnati.
Okay, cool. And when is your date of birth?
February 21st, 1992.
Okay. So today we're just going to take your blood pressure. Have you ever gotten that done before?
Yeah, I have.
Okay. So we're going to do it manually using the blood pressure cuff,
Right.
and this is the blood pressure cuff, and this is the stethoscope. All I need you to do is just relax, and I'm going to rest your arm right here. Okay? So to make sure that this blood pressure cuff is a good size and fit for Scott, we have some good indicators on the blood pressure cuff. Right here it says, we have some arrows with left arm and right arm, and because Scott's right arm is on the table, we're going to make sure that the right arm arrow is going to be right in the middle of his upper arm, with his palm being up here that way. And then this index line is going to have to fall right within this range area as I wrap it around Scott's arm. If it does not fall within the range area, if it's too big or too small, we just need to get a different size blood pressure cuff. The other thing to keep in mind is that after we've wrapped it around, we're going to be pumping up the bladder within the blood pressure cuff. So to do that, we need to go righty-tighty and make sure that this is tight to the right. And then we're going to pump this to 160, 180. And then we're going to slowly let the air out by going lefty-loosey. You just want to be very gentle with how you turn that to the left. Okay, so we're going to put this blood pressure cuff around Scott's arm. Make sure the bladder is completely flat before you do that. And yeah, it's fitting right into the range area, so this is a great fit for Scott's arm. Okay. And I'm just going to put my stethoscope on. I'm putting the head of it right across from the elbow. And I'm going to hold this in my one hand. So, going righty-tighty and pumping. Is this comfortable for you, Scott?
Yes, it is.
Great. So we're going to pump up to 160, 180 in that range. How's that feeling?
Feels nice and tight.
Nice and tight, okay. Let's slowly release this, and we're going to just let the arrow fall slowly to the right. It's going at a great pace. We'll be here for the bumping sounds. You notice how the needle is also twitching with each thump. Alright, so it looks like your blood pressure is around 116 over 75.
Okay.
Alright. And that is how you take blood pressure.